little bit on exercise. You have to do it in conjunction. Like you have to do it. There's no discussion here. And, you know, not just for diabetes, but you can read it for yourself. Look at, you know, the risk reduction. It reduces your risk of even death. You understand? Like you can see you can read this for yourself. Now, if this was a tablet, would you take it? Of course you would. Of course you would. But you know, you can take it. It's yours to take. You just got to do it. Now you can read it. There's too much to talk about here, but look at the 20 benefits of walking just 30 minutes a day. Like insane, absolutely insane. These are also, this isn't just some, you know, Joey putting it on Twitter. It's scientifically proven that these are the benefits for it. It's just a no-brainer, you know, getting active. And there's a book called Spark. Read it. If you want to have a super brain where, you know, your cognitive function, your brain function improves, your memory improves, your attention improves, your problem solving improves, you know, you can learn new skills, your focus is better, you name it. You know, you need to exercise. Like you have to exercise. It's a no-brainer. Okay. Specifically for diabetes, just, you know, you can have a you know, navigate through this, but generally it acts as a hoover, sucks up all the glucose that's just streaming around your bloodstream, and also makes your insulin work better, which is the key here. Makes your insulin work better. Okay, so it's a win-win situation where you have to do it. So just see it. We say, like, this is a very British thing, isn't it? Henry the Hoover. It sucks up, exercise sucks up all that glucose in your bloodstream into the muscles where it needs it, and it also causes your insulin to work better, so your glucose levels will come down. Exercise on its own won't solve diabetes. You need to do it in conjunction with diet as well.